with health systems shifting its focus to help prevent and treat those who succumb to COVID-19. It is also important to remember that we protect everyone's right to access sexual and reproductive health services, including family planning, in the midst of such a global health crisis. People need to continue to be able to make informed decisions about their sexual and reproductive health. Everyone has the right to plan his or her family. Access to the right information and safe health services is a critical element of basic health care, especially for women and girls who are less likely than men to have the power and authority in decision making, especially at times like these. Despite the restrictions and challenges faced with the onset of the national lockdown, the Family Planning Association of India continued to render its services to people in need, especially the poor and the marginalised, who are often the ones who are the worst affected, having little to no access to healthcare, irrespective of a global crisis. In places where the Indian government is present only through primary healthcare centres, the Family Planning Association of India continued to function on the government's behalf. Some of our healthcare workers were even recruited by government healthcare facilities to help in the management of COVID-19 cases, as there was a lack of medical personnel on ground to attend to these patients. As a result of our presence and continued support, especially at the grassroots, the Indian government decided to include family planning and sexual and reproductive health as a part of essential services during the ongoing lockdown. Our teams of resilient healthcare workers at our association continue to be at the forefront and help those who need our help and services. They have been instrumental in creating and spreading awareness on sexual and reproductive health and also on COVID-19. They provide family planning information and services, safe abortion care to women, maternal and child health care, adolescent health care services, HIV/AIDS screening, and last but most importantly, they've been there to help prevent and mitigate gender-based violence through counselling and screening. Epidemics make existing inequalities for women and girls especially, and discrimination of other marginalised groups such as persons with disabilities and those in extreme poverty worse.